Do you think that this is a uniquely American problem? Because when you laid out, I know we're doing simple math, simple numbers here, it costs the average American $15,000 for healthcare a year. The second most expensive countries, you said $10,000. They have better healthcare. They have better outcomes. To me, it sounds like we're getting the short end of the stick, right? I'm paying 5 grand more and my healthcare stinks compared to the other one. I mean, talk to us about that.
Right. And people in America don't know that. We think we have the greatest healthcare system in the world, and it's not even close, right? And so we're paying wild amounts. Yeah, our prices are high, our utilization is high. We have absolutely, I mean, we are as a country have the worst healthcare system in the developed nations. And yet, we pay 3 times as much as the average across the board. And yeah, that needs to change. And we need to all be angry about this and demand this from our government and say, it's not about subsidies anymore. And we keep trying to fix it for this person and that person. It's not working. Our costs continue to rise higher than every other country every year. And that's what needs to stop.
And I think alarm bells really are going off in the country when it comes to healthcare costs, especially now that it doesn't seem like there's any plan that's going to pass through Congress, through the Senate, get signed into law. I mean, what do you think is missing from this national conversation?
What is missing is a single plan. And I know nobody wants single payer, and there's a lot of countries that control this without having single payer, right? Like Germany is a great example. But there is government oversight of the entire system, and there is a budget, right? We don't have a budget for healthcare. Every year it's like, well, whatever it costs, because we're not in charge and we don't have any controls. And so, what we do in MedPAC every year, and this drives me crazy, is we'll sit there and we'll say, well, we can't give anybody any raises, because cost of healthcare is too high. We've been doing that forever. It doesn't control the cost of healthcare one bit. If you don't give people raises, they find other ways to make more money. Right. And so again, we're just, we need to this is it. This is all the money that's coming out, and we all need to figure out how to do it, but we need the incentives, right? And so right now, everyone is incentivized to just do what they're doing. And so, for example, every year, we give the hospitals and the doctors maybe 1% or 2% increases, or zero, same with the other sectors. And why is that, right? So we can keep the cost of care down. But what if we said, look, hospitals, you're 1/3 of the problem. If you solve your 1/3 of the $5,000, we will give you half of it back, right? All hospitals, everybody's in. Keep the quality at the same level we have today or better, and we start sharing those across the entire sector. So we could give them higher raises if they brought down the cost of care by, so let's say over 5 years, you want to bring down the cost of care 20% per year, right? As hospitals are now getting 1%, 2% increases every year, we could give them a lot more of that money, right? If they were part of the solution and we had an ongoing way to actually bring costs down, which has never happened in the history of healthcare in the United States that we've been recording costs, right? It goes up every year. We need to bring it down $5,000. What is a bold plan to make that happen? And how do you incentivize everyone in the ecosystem, including the patients, to make that happen?